Hello, and welcome back to Ask Your Pain Doc. In this channel, we talk about traditional and alternative treatment for pain. I know I haven't done any video recently. I've been busy with life, family, and all of above, but I missed you guys. Today, we're going to talk about very bad and horrible disease that called chronic regional pain syndrome, or CRPS. And we have so many other nice videos coming out soon. So stay tuned, make sure you subscribe to my channel, and let's do it. Chronic regional pain syndrome, or RDS, or Reflex Sympathetic Dystrophy, is a very horrible, chronic, and debilitating condition that is usually characterized by persistent and severe pain and other symptoms. CRPS usually develops after an injury or a trauma or a car accident or a crush injury to the extremities. And the severity of the injury may not exactly correlate with the intensity of your pain. So you may have a small hand injury or surgery and develop severe pain in that part of your body. The condition usually affects any part of your body, but is more common in arms or your legs. The exact cause of CRPS, or chronic regional pain syndrome, is not well understood, but there are some theories that involvement of sympathetic system has a major role in this disease, because we know if we do a certain type of injections or block that block the sympathetic nervous system, there is major improvement in pain with these patients. There are usually two major categories of chronic regional pain syndrome. Type 1, which the old name is also RSD, usually occurs without any known nerve injury. And type 2, which there is a clear nerve injury that can cause CRPS. Well, if I want to give you a typical CRPS, usually a younger patients who develop severe arm or leg pain after minor surgery or an injury. This injury could be a small fracture, a small carpal tunnel syndrome, or a crush injury in a trauma. And after, surgery, patients notice that their pain is still there. It's severe, it's burning. Sometimes in their feet, I have patients that tell me that they're not able to wear socks for a few weeks to few months. And then slowly we'll see some temperature changes, some skin changes, and some color changes. And that's when we would think about the diagnosis of CRPS. So the key features of CRPS is severe pain. Patients describe their pain as burning, throbbing, shooting pain. A term allodynia, which is a severe pain when there is no pain stimuli. So what does it exactly mean? So if I touch your skin, if you feel pain by just rubbing or touching your skin, that's the word allodynia. And you see that very commonly, unfortunately, with patients with CRPS in their extremities, that they have severe pain and allodynia. Changes in skin color or skin temperature. Some patients feel that their hands or their legs feel blotchy, blue, sometimes pale or red. They may also feel that their arms or their legs is either warmer or cooler than the other side. Swelling and sensitivity. Most of my patients feel that they have very bad swelling. So even the size of their arm or their feet are bigger than the other side, and extreme sensitivity that I described. When CRPS become more chronic, you'll see some motor function, including muscle atrophy, weakness, and patients are very difficult to coordinate their extremity movement with the other side. Also, when you deal with chronic CRPS, it can also cause nail and hair growth change. CRPS happens mostly in European ancestor, and the incidence overall is about 5 to 6% out of every 100,000 person per year. CRPS is a very complex and horrible disease. The treatment should be a multimodal treatment. What does it mean, multimodal? Multimodal means you have to have different kind of treatments add together so you will have a better outcome. This multimodal treatments consists of therapy, medication, injections, and other type of health that we're going to talk about. In terms of medication, the simple pain medication including anti-inflammatory like Tylenol and non-steroidal anti-inflammatory medication, usually the first line, and then antidepressant and anticonvulsant medication including gabapentin, tricyclic antidepressant like amitriptyline or nortriptylines are usually the next line. We try to stay away from opioid or narcotic pain medication including oxycodone, morphine, methadone, because there is a higher risk of dependence and addiction, unfortunately, with those medications. Physical therapy and occupational therapy, they have major role in management of CRPS. Therapists usually work with patients to improve joint mobility, strength, and coordination. And occupational therapy helps for daily activity and improve mobility. Interventional or nerve blocks, and that's the time that you see someone like me. When you come to my clinic, sometimes we offer patients this sympathetic nerve block. It is, there are two major blocks that we can have a separate video, but they call stellate ganglion block, which we block the stellate ganglion in the neck area, and also lumbar sympathetic block for lower back and legs. So these blocks can help patients for short term, for a few weeks, and patients able to do more physical therapy and exercise. Dealing with chronic pain can be emotionally challenging and draining. Most of these patients, they won't able to sleep or have a normal daily activity because of their severe pain. And that can cause a lot of depression and anxiety. So treating those emotional issues and having a good psychological support can also help patients with CRPS. Medical infusions including lidocaine or ketamine infusions. There were some studies that showed that these infusions can help patients with severe diffuse CRPS, but unfortunately there are not a lot of centers that offer this type of infusions because of insurance restrictions. Topical treatments, I'm a big fan of topical treatments because the topical creams or treatment does not have any systemic side effects. The amount of the chemical that absorb into your body is very minimal. These medications can be including a simple lidocaine cream, doxepin cream, which is an antidepressant. That's one of my favorite medications. And also compounding cream. This compounding cream comes from a special pharmacy, and you can ask to talk to your doctors, and your doctors can recommend this cream. It can be a mix of gabapentin, Lyrica, ketamine. This is great for patients who get severe side effect from this medication, and they can use it topically. CRPS is a horrible disease, but there are lots of new medication and technique that can help patients with CRPS. If you feel that you're suffering from this horrible condition, please consult your physician or your pain doctor. There are a lot of treatments including therapy, medication, including oral or topical medication. There are different type of injection and interventions that we can help patients with severe CRPS. I hope you've liked my video and I hope you've learned something today. If you like it, make sure you write me a comment, send me your feedback. I'd like to hear what you think about this video, and I will see you all soon.